Duke's gonna see the doctor, huh, baby? Don't worry, we're not gonna leave you. It's okay. It's okay. Duke's just a little scared.
I'm scared too.
Very scared too.
I got to shave, honey. Duke. It's okay, puppy. Come here, Duke. You're gonna be a nice guy, Duke. Nice guys.
Hi.
Nice guys. You're nice.
Can I kiss? Come on, I got kisses. Can I get kisses? You're so cute. Look at you. We don't see too many Karens anymore.
Come here, buddy.
Come here, monkey.
Should I take this off of him?
Yeah. Well, let me turn you around. Can I look real fast? Can I look real fast? Let me look at your teeth. He's what, about 4 months now?
Yeah, you're close. He's not quite on the 11th. He'll be 4 months.
Yeah, you can tell pretty much from his teeth. Well, let's listen.
Yeah, he's been getting a lot of teeth in, like to chew everything.
He's a chewer and a nipper.
So what are some of the first things that you check for?
Let me listen.
Oh, he's got to listen to his heart.
There you go. Yeah, his heart's fine. His lungs are fine. Look at you. Look at you. Look at the guy. Yeah, we don't see too many. Karens are real popular for many, many years. Just want to check your knees, make sure they're straight. Yeah, his patellas are fine. Okay, he's a complete male. He looks fine. He looks super.
So if we want to make sure that he's safe for parvo, you suggest that we do the blood test?
Has he had vaccines?
Yes. He had one. The last one that he had was at what, 12 weeks?
Was it 12 weeks?
Yeah.
Well, what we can do is we can do a parvo titer to see if in fact he's responding to, and that's what we normally do.
So a parvo test?
Yeah, do you want to do it here?
Sure. Yeah, we have to.
Look at you.
How long does that take?
The results will be back in within about 10 minutes.
Oh, really? Oh, that's great.
I think our last Karen got parvo
At 10 years.
at 10 years old.
Which I know is like really unusual, but we're suspicious that maybe.
Well, you see, what isn't realized with vaccines is that the fact that they give the vaccine, they have no indication whether the patient can make antibodies or not. And even years and years ago with infants, with children, after they got their DBT and all their shots, what happened was they used to challenge the child at a year of age with a scratch test. And if there was no reaction, the child did not have antibodies. They don't do that anymore. And now with vaccines lasting as long as they do, and as you know, there's a problem with them. A lot of patients can't handle them. It's assumed that the thing is you do a titer to make sure you got protective antibodies, but often they say, well, vaccine's good for 2 to 3 years, don't worry about it. Well, if the patient hasn't made antibodies, I had if you have a minute, a number of years ago, and I think I have it, I don't know if I have it in this book or not, I think I do, under cases, there was a couple that came in that had a Doberman that had had 5, 6 shots of parvo vaccine, and at 18 months died of parvo. So
the vaccine isn't a sure thing.
We're going to do a titer, Michael.
Oh,
There'll be a blood titer.
Okay. So we'll just take him back.
Is it okay if we take him and then
Yeah.
you guys we can talk? So anyway, these people wanted to be assured if in fact they got another puppy, like yourself, that they would be guaranteed that the patient wouldn't perish from a vaccinatable disease. And one of the hang-ups that you see is that they don't make antibodies. The titer tells you this. So they rescued a real pretty Harlequin Dane named Guinevere, I think from a Fresno animal shelter. And so we went ahead and vaccinated her, and then at 12 weeks got a parvo titer and no antibodies. So we went ahead and did my endocrine immune panel, if you will, and got her back on proper hormone regulation of the immune system so the one immune cell, the B cell, could make antibodies to the parvo vaccine. And we revaccinated the puppy and then did the parvo titer, and she was fine. But this is what you get into. And this is one of the problems I think you see with children with vaccine reactions. You know, we worry about all this stuff. The fact that the vaccine's been given, there's no indication the patient can respond properly to it. And that's what you really get into. And with inbreeding, when the gene pool is getting too close, you are seeing all these hormone imbalances and a loss of control of the immune system. And when that occurs, there's no way that patient can respond to a vaccine. And if they do, it's often with an adverse reaction. And so...
Sorry, Plechner, but we don't have any parvo titer for Mantec. The only thing we have was the snap test in-house.
Well, we'll do the distemper. It's the same. Okay, if they've got it, that's fine.
Okay.
We're going to send that out.
What was that?
We'll send that out to Antec.
No, we don't have anything for parvo for Antec.
No, for the distemper. You're going to send serum to Antec? You're taking a blood sample, right?
I thought you wanted... What did you need?
We want parvo, but if Antec doesn't do parvo, they do distemper.
Okay.
So we'll do the
Do you want
distemper,
distemper?
please. Another ice cream cone. Anyway, sorry about that. But anyway, that's kind of what's happening, and that's what you guys are going to be seeing with so many of these animals. And as you read about the hormone antibody imbalances, it's the same in people. And nobody looks to these imbalances, and no one really realizes that your hormones regulate your immune system, period. And the fact that the hormone is there does not mean that the body can utilize it. The only way you can tell is comparing it to what the antibody production is. And when this is off, you'll see high estrogens out of the adrenals because of the cortisone deficiency, and this has been involved with, I guess, over 200,000 cases, and this is dogs, cats, horses, and people. It's the same in people, but nobody's really looking at it. When that estrogen is high, it opens everybody up, including the animals, to allergies, autoimmunity, and basically to cancer. Every cancer patient has an elevated total estrogen, but the labs, human and otherwise, are not measuring that. They're doing the ovarian estrogens, and guys are doing estradiol.
And so this shows up even in young puppies?
But it can, depending on the severity of the inbreeding. Hopefully it doesn't, and it won't, but we do see it. I think this is why you see it often in young children too, with lymphoma and juvenile diabetes.
So like how far does it usually display? Like pretty, you can pretty much count on it being there or not. So
Well,
you
yeah,
can
what
make a
you
clear
do-
test. At what point, how old are they?
Well, it depends. It depends on the imbalance and the clinical signs they're showing. And if they seem to be perfectly normal, it's not going to happen. But they usually have precursor signs like allergies, like food sensitivities, like overreacting to fleas, females like false pregnancies, chronic ear problem. Any chronicity is an indication of probably this imbalance.
Wow.
And so what you do is you go to the cause of it, because medicine is set up to basically treat the effects. And medicine has been doing this, human and veterinary medicine. The quick fix, a pill. They measure all these enzymatic reactions and a lack of this and this and this, but the truth of the pudding is once you go to the cause and you correct your hormone antibody imbalance, often that medical effect disappears, whether it's in an animal or a person.
And the reason I asked that is I did have an experience with a Dr. Viola Fryman, who's a doctor of osteopathic medicine, and she was in her like 70s. She's known as like the godmother of osteopathic medicine, and she had told me that she had personally seen all kinds of side effects due to vaccine in her practice.
Well, you have to be real careful, yeah.
Of children that she was treating that had been disabled as a result of vaccines, and so I'm just wondering, like, what could you tell a parent when it comes time to vaccinate? You know,
it's gonna depend. I think a lot of it's gonna depend upon the pediatrician and what they think. And I think the other end of the stick is you wonder about they're worried about it's not.
But as a parent, I mean, you have control.
Right,
no matter who your so
yeah.
what kind of questions should you be asking to make sure that it's safe?
What with vaccinations besides like polio and things like this, what can we avoid?
Like
and
the
they're worried
pertussis.
they're worried about the carrier medias now. They're worried about the stuff, the actual,
mercury?
Yeah, comes in mercury, all the rest of that stuff. And so it's a tough deal. And one of the things too, with a lot of third world children coming back into the United States, we were done with whooping cough. We were done with diphtheria. We were done with a lot of stuff, and now it's kind of coming back again. It's a tough deal, because with my granddaughter, we're real careful. And then the question is, how much vaccine should you use? Like,
take a walk on the wild side. Will the birds and the bees survive? Right before me, my newfound hippie side once ignored these conspiracies online. Out the window, visions of the earth. Sign me up now, make sure you use your smart. Take a walk on the wild side. Will the birds and the bees survive? Would your children like to see Mother Nature sigh?
Be sure to visit our website at smarthealthtalk.com.